because actually those experts of experts, I would say, bring enormous advantage to a program, particularly bringing a lot of flexibility to support lab operations in testing capacity, supporting integration rapidly of new tests, because those people are actually already trained on many products. And that is important to be ready in case there is a need to integrate new testing to the platform. So this program is something that we do on site and can be also done in country. And in addition to we do online sessions that are like updates, for example, or complementary information on new product introduction that are kind of customized and tailored to your need. And in addition to it, those experts of experts get this alumni forum where they are capable to ask their questions and go more in deep details on the products and the updates on specific topics. I'm just thinking about the mpox test now and the needs for those experts just to be ready, just in case. This is just the best opportunity for them to always being updated. So this is really a program to train those experts of super users, actually. And we have in the Africa region multilingual trainers for those super users capable to support on the different topics. So if we talk about super user training in Africa, so I will focus only since post-COVID because many things have evolved over that. And we have now trained more than 388 super users post-COVID. So in the last 2 years, specifically in the Africa region. And this represents actually 23 countries in Africa where there are super users. And the truth is that there are more than this, but if we focus post-COVID, there will be 23 countries. They have been in average trained on 8 tests, which is a very important number because that means that those super users already have the knowledge to be ready should the country decide to do integration of testing on any of Cepheid available product. And for you to realize the Africa install base today, so how many gene experts we have in the country, we have about 8,000 gene experts in Africa, and that shows how much possibilities there is to do more testing in the existing platform. Now let's come to the base, right? So where there is gene expert, that was actually linked to TB. So everything started with the TB test. So when in 2010, WHO endorsed the expert and TB-RIF test. And from there, we evolved and introduced the expert and TB-RIF Ultra in 2017 that replaced actually the MTB-RIF test, and countries have transitioned and have adopted the expert MTB-RIF Ultra test. And in complement to this test that is already used, there is the expert MTB XDR test launched in 2020 that some, and I hope many countries are using it as complementary testing for TB resistance profile. So now, how can this platform, Gene Expert, benefit to more patients beyond TB? Which population actually could benefit of it, right? So because there is the TB tests, right, that everybody uses now for with the Gene Expert. But actually, you would see here there is many other tests that are existing. Some might have more relevance to many of the colleagues here online, but you would understand that there is an whole hepatitis and HIV program here. There is a HPV program. There is carbapenemase resistance profiles. There is many other tests available in addition to TB, as well as some emergency products. So thinking about the patients, It could be that a breastfeeding mother and his baby may need HIV testing, right? It could be a TB patient at risk and of co-infection, HIV co-infection. It could be cervical cancer testing with co-infection on HIV. It could be at-risk population, immunocompromised patient in need of hepatitis B or C testing, as well as, of course, rifampicin resistance patient in need of rapid identification of multi-drug resistance. So there is a variety of opportunities to utilize the existing capacity that you have in the GeneXpert. And when you have a system that is properly maintained, which we have more and more in many countries, you have understood from Eliakim presenting that in 70% of the install base in Africa, we now have the capacity to better support because there is service contract. As this evolves, that supports capacity available for testing and opens more options to do TB testing, of course, but also other tests that you would see here. I will just finish by a final slide, which is around the pandemic response. Cepheid is known to be very proactive in responding in emergency responses, and it started long back in 2004 with anthrax. It evolved with flu and Ebola, as many of you would know. And so the GeneXpert is capable to be utilized in case of outbreak. So for outbreak response, Ebola is often utilized, we know that. Of course, during COVID pandemic, it has been a platform that has been utilizing complementary of the existing TB test. And today, again, recently, as you know, unfortunately, we have the Mpox outbreak, and our test is going to be and is being utilized in major countries. So this is just a summary to demonstrate that there is possibility to expand beyond TB and think about integrating utilization of tests, but also resources in the laboratory and operations, how to operate. I will pause here and give back the floor to our moderator. Thank you.
Thank you very much, Indira, for this nice presentation. Colleagues, now we finished to hear about Cepheid's presentation. Please keep your questions in the chat, and we'll be back to you. So continue to remember what has been shared by Eliakim before, from the contact through the global access services, KPIs, etc. And then what Indira highlighted, starting by the super user training, how expert tests have been, let's say, have been developed from 2010 for TB up to now, and from other emergencies like anthrax and flu that has been even done before TB. TB cartridges was endorsed in 2010. So please keep your questions fresh, and we'll be back to you. So now let's go to our last in the list speakers. Prof. Joloba could not be available. However, his colleague Abdunur will cover the presentation, going through what's going on the field, and then you can have an idea about how we can benefit from experts from sample testing up to the reporting. Abdunur, please go ahead, and the floor is yours. Thank you.
Thank you, Dr. Ja. This is Abdunur Nyombi, representing Professor Moses Chiroba. Just confirm that you can hear me.
Yes. Thank you.
Oh, thank you. So we just taking it from there and just giving it from the field update on TB diagnosis services in Uganda. And we know that all our work is responding to the NTB strategy of ending TB by 2035, ensuring that we reduce deaths by 95%, incidence by 90%, and eliminating catastrophic cost due to TB disease. We know that as TB laboratory, we are linked to the three objectives of the NTB strategy, and here we emphasize increasing access to rapid and accurate detection of TB, ensuring that we have access to DST, and making sure that the quality that we are providing to the patients are of good quality. These three strategies are linked to the framework that was published in 2016. That is the indicators for the NTB strategy, where we have about 12 indicators that are under the three major objectives. So as a TB program in Uganda, we work towards achieving the goal of the TB strategic plan, where we are looking at reducing the TB incidence to 160 by 2035. But important are the two strategic objectives that are linked to laboratory, where we want that we improve TB treatment coverage by over 90%. And this is where we have the different tools, like GeneXpert, supporting the case finding, towards ensuring that we improve the treatment outcomes and ensuring that our patients are monitored on treatment. Again, to say that in 2023, we received the new guidance from WHO, that is the benchmarks for universal access to TB diagnosis services, TB diagnostics, and these basically 12 benchmarks that are also guide our program and as our TB lab network in Uganda, so that we're ensuring that patients are accessing screening using the most updated tools like X-ray, ensuring that all presumptive patients access WRDs with GeneXpert, and ensuring that we're able to monitor DST coverage and turnaround time. So in Uganda, currently we have a network of about 1,987 laboratories, of which about 296 have GeneXpert. We have TrueNat, TB-Lamp, but also we are trying to give POC using LFLAM and latent TB testing, where we are having IGRA, and also in the plan of introducing TBS like CYTB. We have TIP2 public health culture labs, some research labs, and we also have that we have an integrated specimen referral system and a connectivity solution that bases on LabXpert disease surveillance. Also, we offer community laboratory services, where we have mobile clinic trucks that have GeneXpert and equipped with X-ray that has artificial intelligence that help us in screening and extending our TB lab services to the community. So in talking of early and rapid diagnosis, the most important thing that our services should be accessible, and this helps us to increase the impact and ensuring that we are able to move towards identifying all people that estimate to have TB disease. So to improve access, we've worked along with establishing and strengthening our specimen referral system that works on the hub and spoke model. And here we have about 100 hubs, but also we make sure that all the facilities of MWR, like GeneXpert, also work as referral sites and able to pick samples from our facilities and take back results. So in line with what we are trying to do to improve access and improve time to reduce turnaround time to results, we've implemented some system connectivity called LabXpert disease surveillance. And this is again is aligned with the indicators that I talked about of the WHO NTB strategy of ensuring that lab networks have data connected systems that are able to transmit results to the national program, but also be able to transmit results to patients and clinicians. So Lab System is a web-based system that we've been able to provide on over 300 GeneXpert machines across the country. And this supports us in real-time reporting of data from the instruments. It supports us in linkage of patients, especially the DRTB patients, where we are having many patients failing to be linked to treatment because of delays in having results available at the TB management sites, but also able to manage utilization and stocks of cartridges. We're able to look at the errors that the users are having at facilities and support them, and also know the failure of the equipment and the modules. So as a result of the 2 years of implementing LabXpert, we are happy to see that we're able to link all our patients to treatment. As we were reviewing data for the previous quarter, we can now see that every region is able to account for all the RRTB patients that are being detected, and these are accounted for in the 21 DRTB treatment centers we have in the country. Another key aspect that we're able to achieve with the 2 years of implementing is that from the turnaround time that we used to have of about 7 days for GeneXpert, we're able to see that our clinicians and patients are able to receive SMS of results and able to improve time to treatment initiation after receiving the GeneXpert results. And this is very key. Another important aspect is ensuring that we track the modules. So we are seeing that with the use of the LabXpert, we have enabled real-time monitoring of the equipment themselves, but also the modules. So at any one time, us at the center, but also our field teams are able to use this system and see which modules are failed and not working in whatever facilities, and be able to support them to open cases and respond within the required time frame. Another key aspect that we are seeing in the field is that we have a platform where we share the transactions of the LabXpert and how different facilities are performing. And this has been a motivation to facilities so that they all improve utilization on their machines. And overall, this helps us to see that it improves the national utilization, and we are seeing more access to TB testing using GeneXpert and other platforms, but also ensuring that helping us to see that we are able to find more patients in our country. Also, you could see that our error rate is dropping because there is a timely intervention, and we're able to use this information and have the field safety technicians be able to follow up those facilities that have errors that are basically due to the user, and able to provide on-site training or remote support and able to reduce the error rate. We believe that this can go below the 4.3% we are having. Currently, we're having issues with power in our network, but once we solve the power backup issues, then we're able to see that this error rate will keep continuing going down as we use the available tools to address the user gaps. So on beyond the GeneXpert, we using the same system on the Dict X-ray. We're able to monitor Dict X-ray that are using the CAD technology so that we improve utilization. We're able to have the same system on the C-reactive protein equipment and other tools like the TrueNAT. So this system, beyond Uganda, we've been able to support some other countries to use the same technology, and to be able to see that we have a more cheaper and efficient way of monitoring our MWD tools and other tools that are able to transmit data. So beyond the connectivity, we're also able to see that following what Elia Kim has shared on the access care, we can see that Uganda was among the countries that implemented access care as one of the models of ensuring the functionality of the GeneXpert. And this started in 2019. And we can see that we have key targets that are agreed between ministry, safety, and other key stakeholders, ensuring that all our instruments, 95% of the instruments are working. Multifunctionality is targeted over 95%, and ensuring that we have teams in the field that are able to respond to breakdowns within or less than 5 days once the technicians report these issues. So we can see that from what we see in these terms of results, we can see that we've worked in terms of improving our KPIs and system availability. We can see that we are now over 99% of our systems being up and running, and this gives us a broader base for us to be able to void testing for our patients, but also what's critical here is that we can see that we are able to report to respond to the issues within time. Of course, there are still issues with responding to module replacement, but again, we can see that being able to have the technician respond within 5 days is something that we've gone a long way as compared to what used to be in the past, where it used to take months, do the process of maturing and all that, and having teams assigned work in the field. So this success program has gone a long way in improving response and also ensuring that we have scheduled maintenance done on time. Some of the things that have been done to support this improvement is that as a country, we are happy that Cepheid is currently in the country. So we moved from having a private vendor to having direct support from Cepheid, which is more responsive. And we're also happy to see that we now have region technicians that are seated within regions, which reduces the time responding to facilities vis-a-vis being in the center and having less reach the users. We are also happy that because of the tight schedules, we have stock of modules and other spares in the country, which improves response. Also, we are seeing that over time, we are seeing more transparency and accountability from the service provider to the customers and making sure that equipments are up and running. Thank you very much for listening. Over to you, moderator.
Thank you very much, Abdunur, for your nice presentation. So colleagues, you had the opportunity to hear from what's going on the field from Uganda. So as you really heard about Abdunur's presentation, I went through the strategy, which is the NTB strategy. And from this strategy, he gave us an overview of the indicators we need to meet. And we're looking at those indicators under the lab indicators and the target framework. We need to understand that the access is the most important. The access for patients or suspects who are mostly having a TB, the access to the diagnostic has been a focus on this, and having a system which is working is very crucial for all of us. And this is the reason why we are having this session, because the access is very important based on the technology we are having on the continent. I think Cepheid highlighted well the number of gene experts we have on the continent, which is really huge in terms of numbers, and we need to make sure that we can use them in the integrated way. He highlighted this simple referral system, which is integrated. Very good experience, and the colleagues, I believe you really took note of this. And also he highlighted the benefit of having this integrated sample reference system, including also the lab experts as the laboratory information management system, which has been used to increase the time to initiation of the treatments, and also to monitor the equipment failure and the functionality of the equipment as it is. So colleagues, we still have, I think, about 13 minutes of questions and answers. Of course, there have been many questions in the chat that have been answered directly by colleagues. And also there will be records of this session. So you might go back and look at what has been presented, and also which kind of the answer that have been provided by the speakers. So let's go to the Q&A questions and the comments for about 10 minutes, and then we can end our sessions. So I'm going back to my colleagues from Cepheid in case you succeeded to retain some of the questions. I found questions about the HPV, whether there are cartridges for HPV, and also there was a question about the local service providers who might be slow in responding, etc. And also there was another question about the availability of XDR cartridges for bedaquiline or new drugs. And also a question about the cause of modular failures. So maybe colleagues from Cepheid, if you can clarify some of those questions among others, it will be great. Thank you.
Maybe I'll.
Would you want
Yes,
to
I can start.
maybe with the service element, maybe?
Yes. So number one, there was a question about uptime, module uptime, just to understand. So module uptime, we are looking at how many days your modules or your system is available to carry out testing. So I don't want to be very technical, but as I gave the example, if you have your module within a month, which is supposed to be working for 30 days, and it is not working for 1 day, then the uptime or the availability is 29/30, and you can convert it into a percentage. So what we are doing when we look at the module uptime, we are not looking just at one module, but we are looking at all the modules in your install base. So if you have, for instance, 100 modules, then you should have 100 times 30 days, which is 3,000 days. So if you have maybe 3 modules failed for 10 days each, then the total number of days they have failed is 30 days. So you have your 2,970 days they are available, divided by 3,000 times 100. So sorry, I don't want to be very technical, but in simple, it is just the number of days your module is working in a month and able to give you results. That was number one. Number two, about the improvement on the module, why it is much better. After investigations, we found that we needed to improve on the heater, especially based on the conditions we are operating in Africa, the environmental conditions. So there was improved heater that is coming with the new modules. And these heaters, I know it takes time to replace. We began this in July 2023. And based on the numbers, we only replace when it fails. So it will take a bit of time, maybe until 2025, 2026, to mop out all the previous modules that were in the field. I don't know if there was any other question related to service that I might have missed. So I think there was one in terms of our partners being slow. I would like to confirm that we do monitor with our our partners in countries, especially where we have contract. And maybe I'll put my email for now. If you reach out to me, I'll share with you our service manager for the country email, and then he will be able to reach out for this specific case. So I'll type my email address there just for this specific issue. But I've put also our support line, which is 24/7, support@cepheideurope.com. So that if you send an email there for any escalations where you don't find support, we will respond to you immediately. You will get our response within 24 hours or less. Thank you for now.
Eliakim, maybe there is a question that is interesting for everybody. I saw it here, but how can how can we analyze KPI from the machine? So obviously you can give the answer on also how you are gathering those KPIs that you shared.
Yeah, so a few ways. So the first way we are analyzing is when we receive a complaint. So as the end user, we have contacts within the country. So what we do, wherever we get a complaint or a case or a ticket, whichever way you call it, then we have our monitoring system, a customer relationship management tool, salesforce.com. So we log that case immediately. And once we log it and we share with you a case number. Then we start tracking it from that point. So if, for instance, we said our time to resolve it is to be 5 days, then from the time you call us to the time somebody comes to your site, we measure that time. So that is just an example. The other KPIs like module replacement rate, we look at how many modules we replaced within a month. Let's say they could be 10 or 20 in a country, or the modules that had cases. Then we divide it by the total install base to get the percentage. So it is more, we have a tool, and this tool, we have also extended it to our partners. So every country where we have a contract, our partners also use the same tool, the same Salesforce tool to log these cases, and then we track it together. And we report this on a monthly basis to every country. I think Nyombi from Uganda just showed you a table which confirms that we are reporting this, and we are very transparent, and we share with them for any feedback every month. Thank you.
Thank you very much, colleagues from Cepheid. I succeed to get also some other questions, maybe where you might have further responses. It's about experts cartridges availability for Mpox. Maybe if you can talk a bit about it, knowing that now we are really facing emergency, and specifically Indira, you are the focal point for these emergencies and antimicrobial resistance. I think we need to better understand, and looking at the number of really the system we have on the continent in the African region, and what we are facing as emergency responses. I think it can be beneficial if you can have a comment about that. And also the use of experts on stool without the biosafety cabinet. For this one also, I can even answer to that. There is, expert can be used from stool for children without the biosafety cabinet, because of the what it is required for expert to be operational is the same environment as microscopy. Another question also for Cepheid is about if Cepheid can take back the equipment at the end of the contract. So I think maybe if we can comment about that, Indira, because the challenges we faced also on the continent was these machines that were broken. And there was even a question about leasing machines, if there was a way of even leasing and get machines back and provide new ones. Maybe if you can have a response to that. The last note, the list is about the cause of module failure. According to you, what are the main cause? Countries or colleagues who are listening to us can take care of to avoid module failures. Over to you, Indira.
Sure. I'll start with the equipment part because I think it's an important one. Am I audible? First of all, just checking in again.
Yes.
All
yes,
right.
you can hear.
So equipment. So there, as you know, the GeneXpert exists since a long time. In the African continent, we have it since 2010 already. And so obviously there has been two versions of the GeneXpert. The first generation of GeneXpert, called the R1, was the system that was with a gray outer box. So some sites, some countries have still that machine working very well and operating very well. So that was the R1. And then the white box that is more widely available across the continent is the one with the white outer box. So this first gray box, called the R1 instrument, is no longer available. We stopped producing it back in 2012 already. So any new system was then obviously the next generation called R2. And for more than 10 years, we continued supporting with the parts and all the elements of the first generation of the R1, so this gray box, we were still supporting it. Last year, or like last year and a half ago, we launched this trade-in program because these old machines, and there are few still in the country, we cannot offer support on these parts. Therefore, we have launched a trade-in program which allow us to support you in recycling the old R1 Gene Expert in case it's no longer functional, and support you in procuring with an adapted pricing model for you to procure a new Gene Expert with 10 color capabilities to run all the tests that are available in the menu, and supports TB, of course, but supports all the other tests as well as TB XDR. So those R1 instruments, should you still have some and should they be staying on the corner, not being utilized, please take that as an opportunity to, if you need, to replace them through a preferred pricing to a new system. And we take care of recycling it. We leave you the computers, of course, but for confidentiality purpose, but we take care of recycling the old instrument, should you agree. So that was for the equipment part. There was a question on stool. So Jean de Dieu already gave you the answer from WHO. And of course, so from Cepheid side, the only recommendation we can give is any sample that is outside of the normal recommendation from Cepheid needs to get recommendation from our medical scientific affairs. In the chat, Nduku has been kind enough to put the link to the medical scientific affairs team from Cepheid, so you can reach out to this team and get the most up-to-date recommendations and get the best support. Next question, I think, was on Mpox. So we do have a test. Yes, I showed it briefly. We do have an outbreak at the moment in DRC, Burundi, and this is increasing a little bit. So we have a test. That test, I'm trying to compile different questions I have seen in the chat. That test doesn't have the pre-qualification yet. It's an ongoing process. It has the emergency authorization at the moment. It is a product that can be utilized in the same Gene Expert platform that you have already, whether it is a 6-color or a 10-color instrument. The Mpox test that we have from Cepheid targets the non-variola orthopox and the clade 2. The current outbreak is focused on the clade 1, and I know I saw the question on clade 1b. We do not have the call out on the clade 1b. We do not have the call out on clade 1, but we have the call out as positive for non-variola orthopox, which translates based on clinical response and clinical decisions to a positive clade 1. Further analysis are required for clade 1b or a distinction, and that's where the surveillance piece comes in the picture, I believe. I don't know if there was, there was another question on cause of nodule failure. Eliakim, you want to give some brief response here? We are on time. Okay.
Yeah, so some of the causes of module failure, as I mentioned, across Africa, are mostly environmental. So number one, as I mentioned, one of them was temperature, which Cepheid worked on. Number two, we have the dust, because there is filter also for cooling. And so you find if it is clogged, then sometimes it brings a problem. We have real issues around power and power fluctuations. As you know, even your domestic gadgets, if they are not protected and there is massive power fluctuations, then sometimes you find that your electronic systems or electrical systems will fail. So those are some of the key things we have observed across Africa are mostly related to environmental, the ecosystem in which we operate the systems. Those are the key ones. So we recommend UPS, especially for power. Where temperatures are high, we recommend air conditioning. And I think we've worked with a few countries and we've recommended this so that we can reduce not only the module, but generally the system failures. Thank you.
Okay, excellent. Colleagues, I think we are now, we need to close this session. The presentation will be available through the ACLM website. Some of your comments, questions which have not been yet answered will be answered. There is a way also to contact CFAID or to contact ACLM for a follow-up. What we can retain as a key message from this session is that Gene Expert System is offering all of us a great opportunity. This is, as showed by CFAID, a test that has been really available for more than 10 years and being used in different diseases from the anthrax through flu, tuberculosis, HIV, hepatitis, sexually transmitted infections, emergencies, HPV. So this is a technology that is giving us really a range of tests. And also this is the first technology that could really be decentralized as being molecular, as you all know. It's a near point of care. And let's make sure that it is used. Colleagues, please contact CFAID. You got the contact names. You got nice pictures of everyone. I think Eliakim, you showed the pictures of everyone, where they are based. And also you shared the email address of everyone who is the focal point. Colleagues, make sure that those technologies can work. We need to increase the access to testing or diagnostics. We need to keep in mind the patient. We need to make this technology functioning because they are closer to the population to fight diseases starting by TB, HIV, hepatitis, other emergency diseases. And also we need to follow new developments as we move forward and make sure that services provided is used optimally. Colleagues, let me stop by here and thanking everyone who has been connected and thanking ACLM for organizing this platform and allowing all of us, CFAID, the SRL Uganda and WHO Afro to organize this session, and all of you who have been connected for about 1 hour. I thank you very much and say goodbye. Thank you. Bye-bye.
Goodbye.